Good afternoon, Dr. Henry. The day the election was called, you announced we had 8,200 cases. Today, there's 5,000 more cases. Why has it taken you so long to announce a crackdown? Is it because the election was underway and you were holding off?
No, I think it's pretty obvious to people that we were doing a number of things through the last few weeks. My focus has been entirely on managing with the team what is going on with this pandemic, and it continues to be. And we have taken additional measures as we've moved through these last few weeks. We did indeed put in extra restrictions. We had flattened our curve, but as you know, prior to Thanksgiving, I made a lot of appeals to people about the need to keep family gatherings small. And unfortunately, there were a number of events that have happened that have led to quite dramatic increases over the past week, as you've seen. And as last week, we talked about the measures that we're stepping up around enforcement and monitoring and proactive inspections in businesses to remind people. And I think we have to remember that we've had a lot of successes. We've been able to open schools. We've been able to open many businesses. We've kept many of our essential businesses going with very few to no cases. But it's hard. It's hard for people to remember every day to check themselves, to think about the risk. And we've seen, like every jurisdiction around us and around the world, that we've seen a resurgence of cases. And we're not immune to that here. And in the last 2 weeks, that resurgence has really focused in some areas of the province and has become at a level where we're stretching our resources to be able to manage contact tracing. And that's why we're adding the additional layers today. I heard from many, many people that they just want to know what the rules are. And people wanted to be able to have large gatherings, and it seemed like it was okay if it was under 50, but that has become clear that it's not okay anymore. And the risk of transmission goes up as we head into the winter season, and it's becoming more and more challenging to determine if somebody has COVID or influenza or RSV or other respiratory viruses we're seeing. So that has been the focus, and that's what we're focusing on now. We need to do this now and into the new year. It's going to be some months before we are through this part of this pandemic here in BC. I am hopeful that we will have things like a vaccine early next year, but it's not going to be for everybody all at once. So we need to do our bit now to focus on our priorities, which is keeping our businesses open as much as possible, keeping our schools open, and keeping our communities safe.
Vaughn, do you have a follow-up?
Yeah, again, to use your numbers, Dr. Henry, it looks to me like almost a 40% increase, 38% increase in the case count in a little over a month. Had you acted sooner, do you think you could have bent the curve before now?
Well, I think we did actually decrease our curve, and now we're seeing it increase more in a focal area. So these are things that, we'll see. On the other hand, we talk regularly with my counterparts in each health authority, the people on the ground who are doing the contact tracing. And as I've said all along, we still 80 to 90% of our cases are linked to a known case or cluster. And there are some times where it's gotten out of control for us a little bit, and we looked at that with nightclubs. We looked at that over the summer where there was large vacation parties. And when we put in measures to restrict those and tell people clearly what the rules are, we've been able to bend that curve down. We need to do that now.
Next question is from Joel Ballard, CBC.
Hello, Dr. Henry. You mentioned a crackdown on private gatherings, and we also know that there's more than 50% of the cases of COVID-19 in BC in the Fraser Health region. So I'm wondering, how much consideration did you give to implementing these new restrictions only in the Fraser Health region?
Yeah, we have been thinking about that, and the approach that we've taken in BC is looking at those settings where the risk is greatest. So yes, it's private gatherings, a large proportion of them that have been led to transmission to larger numbers of people have been in the Fraser Health region. And that reflects the fact that more of it is circulating in the community there. But we have seen celebrations of life in the north, for example. We've seen parties associated with transmission in every part of the province. So the setting itself is the same. And I am hearing from people in the community, from business people, that when people follow the rules, things are working fine. But it's this sense that it doesn't apply to me, and that it's okay if we are okay in the church and at the gravesite, but then everybody comes back to my house. And unfortunately, we've seen transmission happen in those events, and people go back to other parts of the province. So what we're trying to address is these are the rules now for all of us around holding events in our house where we don't have that space to keep people safely separated and where we're seeing transmission. In addition, we are looking very carefully at are there other measures that need to be in place where community virus, spread of the virus is much more apparent, and that is certainly in the Lower Mainland and particularly in the Fraser Valley region and the Fraser Health region. So we will be looking at that, and we have been working with Fraser Health and will continue to look at other things. What we want to do is make sure what we're doing addresses the issue. So we're tackling where we're seeing transmission events taking place. And we're trying to find that balance so that we can keep as much open as possible. And we're not seeing, for example, transmission in restaurants where people are following the safety plans in those restaurants. So we're not looking at closing restaurants right now. What we're looking at is adjusting and titrating to those places where we're seeing transmission happening.
Keith Balger, Global News.
Hi, Dr. Henry. Thanks for this. Are you concerned that people are exploiting the 50-person rule by gathering in numbers, say 40, 30? We discovered an arts fundraiser over the weekend that had 500 people spread out over a number of venues, insisting they were following public health guidelines. But the one venue we saw in a hotel, clearly people were at very close quarters, and they are obeying the 50 number rule. But are you concerned that people are sort of exploiting that by coming in with gatherings and events that take place with large numbers, just not 50?
Yeah, so there was some occasions. I won't say the vast majority of people are doing this right. And we've looked at hotels where they've had appropriate safety plans in place, and people have stuck with them. So those are the things that I mean, we have to say that most people are doing it right, but we're now at the verge where we have seen enough transmission that we need to take action on these areas. And what we're seeing is that, yes, it may be a small group, maybe 30 or 20 or 30 people, but the space may not be big enough to allow people to safely maintain safe distances from those who they are not within a close bubble with. And that's important. Or we see sometimes that people will invite others in because many celebrations, it's cultural or it's usual for people to be able to bring others with them. Right now we can't do that because we see it transmitted and it's challenging to know who is actually there. So there may be events that happen over 2 or 3 days with a different group of 20 or 30 people each time. And that again means that this virus can be transmitted to a much larger group of people, and it may be challenging to find them in a quick way. So those are all things that have led us to take this action today. I will say that every single person is continuing to be followed up, and public health is working at the contact tracing, and we're using the data that we're getting, the understanding of where exposure events are happening to titrate our orders and make sure that we can try and keep this under control.
Keith, do you have a follow-up?
Yes, in terms of enforcement, what would that look like? Are we talking bylaw officers, public health officials? And if you see a bunch of cars outside a private home, for example, should the authorities be contacted by someone who witnesses something like that? That there's obviously a lot of people in the residence?
You know, I think we need to trust people, but yes, the orders are enforceable by bylaw officers, police officers, and environmental health officers. In the same way that we had the orders during the summer at rental properties and places, and I expect that the same processes will be followed. So yes, you can complain if there's a large party, as you would for any noise complaint or other things. But I also know that most people will do the right thing. And it's not that people have intentionally tried to skirt the rules. It's mostly, we get this sense of complacency that it's okay, that the rules say it's this, without thinking that how important it is to make sure that you can make people safe in those environments. And most homes are not large enough to have 50 people or 30 people or 20 people. And now that we're moving into the season where we can't be outside as often as well, we know that risk goes up. So it's, these are important considerations for us moving into the next few months, where there's going to be a lot of temptation, and we need to support each other as communities, leaders in communities, leaders in families, to make it okay to have the small wedding right now with just the immediate family, and plan that party for next year when it's safe.
Next question is from Lisa Cordasco, CHLY.
Thank you, Dr. Henry. I just want to clarify, because in your statements you had mentioned that these new health orders will likely be in place into the new year. So does this mean basically that Christmas gatherings are out?
Yeah, I think we need to consider all of the celebrations that are coming up, whether it's Diwali or Hanukkah or Christmas, and look at how we can regroup and focus on our immediate families and making sure we can support each other to do it safely. So that is a possibility, that we would not have large family gatherings over Christmas. And we need to focus on our small groups.
Lisa, do you have a follow-up?
Yes. When I look at my own Island Health region, Island Health, there hasn't been a single case of COVID in a care home since this all started. The numbers over the weekend, 0 new cases here. What kind of a challenge do you think it might be to impose these even stricter orders in areas where the transmission rates are so low compared to the Fraser Valley?
Yeah, and we have a lot to be thankful here on Vancouver Island. We know that there have been some exposure events, though, in schools. There has been some transmission, and we know that this virus transfers through people. We bring it with us when we come. The good work that's been done by Vancouver Island Health Authority in making sure we had all the provisions in place that are needed to protect our care homes. And as you say, because we don't have high numbers of circulating virus in the community, we've done an amazing job. They've done an amazing job of protecting long-term care homes here on the island. But it doesn't change the fact that if we have a large gathering and people are coming from other parts of the province, they're bringing risk with them. And so, yes, the fact that we have very low rates here on the island is protective, but it's not absolute. And we need to be aware that having a large party, a large wedding, a large event introduces risk. And the risk is less than what we've been seeing in other places, but it's not zero. And this is to try and address those issues. It doesn't take much for things to take off, as we saw in the summer in Kelowna, for example, and as we saw in the north with a couple of large gatherings where there was transmission to a number of different communities. We've seen it in different parts of the province, and we've seen an outbreak in the north of Vancouver Island. So it's not that we're out of the woods. This virus is circulating all around us, and because people are moving, there is a risk. And so that's what this is trying to address. But of course, the clear and present danger right now is the higher rates of transmission in the Lower Mainland.
Just wondering what you, on the topic of weddings again, what you have to say to people who, think they're following the rules. They have maybe 25, 30 guests, but then they have photographers and DJs and caterers and musicians and whoever else they feel is important to make their night special. What do you have to say in terms of guidance on that sort of thing?
You know, and there's been many of those weddings that have gone on perfectly successfully where there's a plan. And there's a plan that keeps people separate, allows them to have the space they need, makes sure that there's not mixing of people from different groups or bubbles, that we have small numbers at the tables, that the servers are wearing masks, all of those things in place. And I know that there's been many successful weddings at different events that have followed a COVID safety plan where it's worked and it's been fine. But what we're seeing is creep. People are getting tired of that. And so or they feel that they want to have larger numbers of people in a smaller venue. And those are the things that we need to pay attention to now. So yes, develop your plan, make sure that you have the right number of people for this physical space that's available. Do it outdoors as much as possible, keep people separated, making sure that we're reducing those risks of transmission. And that can be done safely.
Srushti, do you have a follow-up?
Yeah, do you think that the onus should be somewhat on those businesses to maybe say no or walk away from gigs that they feel aren't being safe?
Well, and I do, and I've heard from many businesses that they've been trying to do that, so I think it's both of us. We need to recognize that these safety plans are there because they work, and they protect both the people who are working at the venue, but also you and your guests and your family. But we both need to take that pact to work with each other. And I hear from some businesses that they have these plans in place and people agree to them, but then a whole bunch of other people show up and they don't feel comfortable, and they get a hard time from their guests. So I'm telling all of us, we're going into a very challenging and difficult few months. We know that because we've watched what's happened around the world. We are doing okay here in BC because of the role that everybody has played. Everybody has done their part. And I know it's challenging to hear this, but we need to buckle down and we need to have respect for each other and continue to do our part and get through this next few months. And that means doing things small and safe.